Hey out there, and welcome to the show today. We're here with Rayner at ASCRS 2023 in San Diego, California, a location on the front lines of the battle against climate change, to talk about sustainability and the future of ophthalmic surgery with HASA OPTIX' sustainable, single-use surgical instruments. And sitting down with us today is someone who knows a thing or two about ophthalmic surgery and the demands it puts on both the surgeon and the environment, Dr. Cathleen McCabe.
So I'm Dr. Cathleen McCabe, and I practice on the west coast of Florida, where I'm a cataract and refractive surgeon in a busy practice. One thing that we really need is efficacy, of course, and efficiency in order to continue to practice the way that we do. But we also want consistency in the materials that we're working with. We know that we need to really take control of what we're thinking about when we bring new products into our facility. We want to make sure that there's something that we can, number one, always access, that they're good quality, precise, but then that's not the end of the story. It's kind of been the end of the story so far. Yeah, so I have had the opportunity to use HASA OPTIX instruments, and for a disposable, but really recyclable material, I thought that there would be a compromise in reaching that goal with the quality and precision of the instruments I was using. And I was really surprised at how fine the instruments were, and really in some ways better than what I'm using that I re-sterilize all the time. When I think of the spectrum of choices that you have between a reusable, re-sterilizable instrument that you're going to use until it dies, and something that's pristine and perfect every time, my concern is that the pristine, perfect one every time that's single use is maybe poor quality, or it's contributing to all of the issues we have around OR waste. And so I think this actually is sort of this beautiful marriage of the two positives of those two different choices. And it kind of gets rid of the negatives of both of the choices. I had a case the other day. It's a younger patient. He was in his 50s, which is very young to me. And he had been hit in the eye with a tennis ball and had a dislocated natural lens. Really no zonules. The lens is kind of floating in the eye, and that's a very complex case. But I wanted to retain the capsular bag, and so I needed something that I could do a very complex but controlled capsulorhexis with. And I initially went to my trusted, instruments that I've always used. And then I went to a little finer version of that we had. And in the end, I asked for the HASA OPTIX Utrata because I had tried it a few days earlier. I knew we still had some. And it was actually the finest tip of any of the things I had available to me. So I think that, to me, that was like, okay, in a time of stress and need, I went to this instrument that I would think initially thought would have been poorer quality, which I thought was actually exceptional quality. The idea of repurposing the materials that are in the instruments, so you're not really recycling it in that you send it back in and you get the same instrument back. But what we want to do is take finite supplies of materials and not put them in landfills. We want to be able to recycle them, repurpose them to another use. I'm really excited to see that there's a company that cares about this. I think that as we look to the future, these issues of sustainability and what we're doing with waste and how we're managing that, and really CO2 emissions and our carbon footprint, are only going to be more and more paramount and more in the focus of what we're doing with our decision making. You're going to maybe be the beginning, if you get a relationship with HASA OPTIX and you're using these instruments, you're part of the solution. And I'm excited to see where it takes us in the future.